Hi, my name is Tracy Now and I'm a Research Officer at the University of Sydney. Before I present some of our work on supporting systems approaches for physical activity in Australia, I'd firstly like to acknowledge and pay my respects to the Camaragal people, the traditional owners of the land on which I'm meeting today, and the important and rich contribution of our First Nations people as the original systems thinkers from whom we have much to learn. I'd also like to acknowledge the rest of my team, Karen Lee and Professors Bill Bellew, Ben Smith and Adrian Bowman. To give you an overview, I'll start by providing a brief history and a policy context to this project. I'll then move on to mapping the 3 Ps, which was about understanding the physical activity landscape in Australia. Some resources we've developed for policymakers on using systems approaches for physical activity, which includes Getting Australia Active 3. I'll touch on legal approaches for physical activity, which is an area that we're starting to investigate before summing up. Systems approaches are a relatively new concept in public health, but the general concept of intersectoral policy planning for physical activity is not entirely a new one in Australia. Several jurisdictions at the state and national level have attempted it in the last 25 years, but they haven't been sustained due to shifts in political agenda and will. The release of the World Health Organization's Global Action Plan on Physical Activity, or GAPA, provided a renewed opportunity to revive physical activity as a political priority, and this has been followed with some supportive policy developments in Australia, including the development of Australia's first national sport plan, which adopts the WHO GAPA goal as a major policy objective, as well as some other national and state strategies for physical activity that are being developed. Some states are also explicitly recognising the value of intersectoral approaches to health and wellbeing, and they're taking some key steps towards this, such as by establishing new structures to foster cross-government collaboration, and I've just included a few examples on this slide. So it was out of this context that ASAPa, our project, arose. Our aim was to foster systems thinking and to support systems approaches for physical activity. So we firstly set out to map and to understand the existing landscape in relation to adults and to 3 Ps. Policies, programs and prevalence, so understanding how physical activity is being addressed in policy and programs across a range of different sectors, and how the different states and territories are measuring population physical activity. We approached the mapping work by engaging early with our government stakeholders. Fortunately, there happens to be a legacy network called the National Physical Activity Network, or NPAN, which is an informal cross-sectoral network of interested and engaged policymakers who are involved in physical activity. So it was through NPAN that we were able to gather over 30 policymakers from health, transport planning and sport to 2 national meetings to share information about the 3 Ps. And it was through these meetings that we also learnt that while there was some awareness of what systems approaches were all about, there was limited experience in using them, suggesting a need and an opportunity to build capacity in this area. So our later work has tried to address this by developing resources such as a Conceptual Systems Map for physical activity and Getting Australia Active 3, which I'll talk about later, and more recently developing understanding about the role of particular policy levers such as law and regulation, and supporting efforts to build national consensus around a comprehensive and a standardised surveillance system for physical activity. So in the next few slides, I will highlight some of our key findings from our mapping work, noting that they may no longer reflect the current situation, as it has been a few years since we conducted this work. In relation to the policy audit, we identified over 100 relevant policies, mainly at the state and territory level and mostly aimed at the general population. We found considerable action related to the planning and transport sectors to promote the GAPA domain of more active environments, and we saw this in a few ways. For example, planning and infrastructure was a key sector lead for developing relevant policy. It was also a key policy domain where action was proposed, along with transport and environment. And most of these policies addressed physical activity in terms of it being a co-benefit of achieving a different objective, such as improving livability or road safety. We were also interested in understanding to what extent agencies are working in connected or siloed ways when developing and implementing physical activity relevant policy. And here we found some encouraging indications of multi-sectoral engagement. For example, almost half of the policies were developed using 2 or more agencies. Responsibility for policy implementation was also most commonly described as shared, such as between lead and partner agencies. And in most cases, policies addressed physical activity by covering 2 or more different policy domains. So all in all, this suggests some existing linkages that could be leveraged or strengthened for a more coordinated systems approach to physical activity in Australia. We did, however, identify a few areas for further attention. The audit revealed limited consideration about high needs groups and what can be done in healthcare and workplace settings. It also suggested scope to use a wider range of policy mechanisms because the most common mechanism was informational in nature, such as education or the provision of guidance for policymakers and practitioners. Finally, the findings suggested greater attention is needed towards the active systems component of GAPA because few policies described clear arrangements for funding or specific indicators to support and monitor their implementation. And where governance arrangements were described, these were very rarely independent of government. In terms of the programs audit, we found that most were similarly aimed at the whole of population, although some programs contained components that were aimed or adapted for specific groups such as older people. In contrast to the policy audit, where planning and transport policies were quite prevalent, most programs were aimed at the sport and recreation and the local government or communities settings. And similar to the policy audit, there were far fewer programs in the workplace and healthcare settings. We wanted to understand what modalities the programs used to promote physical activity, so we adapted an existing international classification for physical activity interventions, which covers those with an individual, a group, a provider, and an environmental focus. The most common modality used by programs was funding to support the delivery of programs by others. Provision of information was also quite common, and we included mass media campaigns in this category. And what you can see on the other end of the spectrum is that environmental change and transportation interventions were the least commonly described or used, suggesting a potential disconnect between policy development and implementation. So in relation to our final P, prevalence, and what you can see here are the prevalence estimates of the proportion of the adult population meeting physical activity guidelines as reported by each of the states and territories. What you can see is that some jurisdictions have numbers against their trend lines, and these represent points in time where they changed their questions or their definition of meeting physical activity guidelines. And what this graph shows overall is a great deal of variability between jurisdictions and fluctuations over time. But this variability and these fluctuations cannot all be attributable to that jurisdiction's policy or program settings, because in this graph what we can see from the state-based analysis of the National Health Survey, which uses standardised questions and methods over time, is that the jurisdictions are more similar than what this previous graph would suggest, and that they are following a very similar trajectory. This lack of standardisation limits the comparability of prevalence rates within and between jurisdictions and how informative they can be for understanding the impact of policy and practice. This has been a long-standing issue that the National Physical Activity Network, our stakeholders, what they have recognised and what they have tried to grapple with over time, and they have expressed support for building a more standardised and comprehensive surveillance system that not only captures changes in physical activity levels, but also integrates measures of the built environment and data from non-health sectors. So in the next few months, we'll be progressing these discussions with each of the individual jurisdictions before deciding whether we take it back to a national forum. So in the next few slides, I'll present some of the resources that we've developed, including Getting Australia Active. What you see here is a conceptual systems map that we developed to provide a big picture reference for how to think about the multiple influences on physical activity. So in the centre, in the dark blue, we have the core influences on physical activity. In the light blue, we have the intervention points in the system and the 8 domains for investment. In the dark green, we've identified politics, lobbying, and social advocacy as other factors that interact with the system. And in the light green, we have governance and knowledge mobilisation. So this map helped us to structure the GAA3, or Getting Australia Active 3, which I'll speak about next. Getting Australia Active 3 is an evidence-based guide for policymakers on implementing a systems approach to physical activity in Australia. And as the name suggests, it's not the first of its kind in Australia, but the most recent in a long lineage of evidence reviews for physical activity that Bill Bellew and Adrian Bowman have led in the past 25 years. What is particularly different about this version is its explicit focus on a systems approach. So in Chapter 2, we explain in detail what we mean by this. We also set out evidence-based recommendations for the 8 domains, which you saw earlier. And since population subgroups received limited attention under existing policies and programs, we've included a separate chapter on addressing equity. And finally, we've outlined considerations for a comprehensive surveillance system with some recommendations around how to measure population physical activity, as well as changes in the broader system. And this can all be freely downloaded from the Prevention Centre website, and I've included a link at the bottom of this slide. To aid knowledge translation and to promote uptake of this guide, we developed policy briefs to highlight key messages from our major chapters. The feedback that we've received from NPAN, our stakeholders, has been very positive, but we recognise that the GA3 is just one tool to help build capacity in this area and to help translate evidence into practice. Finally, I'll touch on our initial work in exploring legal approaches for physical activity. The reason we started exploring this area is that it was identified by NPAN, our stakeholders, as a priority area. Compared to tobacco control, for example, law is a relatively underutilised, not particularly well understood tool for physical activity. So potentially by building understanding and knowledge in this area, we're presenting new levers for accelerating progress towards the GAPA target. This is a framework that we developed to help understand the role of law in influencing physical activity and to help unlock some of its potential. So I'll just walk you through some of the key elements. At the centre in the purple, we have lawmaking, and that refers to the determinants of lawmaking for physical activity. So, for example, what is it that influences governments to use law in the first place to address this issue, or understanding how physical activity promoting laws get passed. Surrounding this, you can see 7 different legal mechanisms such as educating or informing, providing funding, creating incentives, requiring something or setting standards, authorising or establishing a mandate for something, through to prohibiting or discouraging and exempting and deregulating. And these are all the different ways in which law can operate to affect change. In the outer 4 boxes, we've identified those GAPA areas where change can be affected by law. And in the light blue ring, we've identified compliance, implementation and enforcement as key mediators of action, because the effect of laws on physical activity not only depends on what they say and what they cover, but also how well they are implemented, complied with and enforced. So how to use this framework. For researchers, the framework can be used to help develop research questions or ideas. And for policy partners, it can be used to prompt consideration about the breadth of areas where law and regulation might make a difference for physical activity. So to sum up, Australian policy for physical activity has had periods of advancing well, but then faltering due to shifts in political agendas and priorities. Recent developments have created a renewed opportunity for using systems approaches for physical activity, and they coincide with some state-based efforts to pursue more intersectoral approaches to health and well-being. Our project has adopted a collaborative approach with policymakers and taps into an existing physical activity network to foster systems thinking, improve understanding of the existing landscape, and to encourage action towards better policy and practice. Our mapping work revealed some key gaps and opportunities where policies, programs, and prevalence or surveillance systems could be improved. And from the mapping work, we developed an evidence-based guide for policymakers Getting Australia Active 3, which aims to provide action-oriented guidance on implementing a systems approach for physical activity, primarily with the Australian context in mind. We're building on some conceptual work into legal approaches for physical activity, and we're also planning some workshops with the states and territories to advance discussions about building a more standardised and comprehensive physical activity surveillance system in Australia. So thank you so much for tuning in, and thank you to ISPAH for the opportunity to present our work and to have this important discussion. Finally, I'd like to once again acknowledge the members of the ASAPa team, Karen Lee, who was instrumental in the early stages of setting up this project, and the investigators, Professors Bill Bellew, Ben Smith, and Adrian Bowman, as well as our funding partner. If you'd like more information about our project or to access some of our resources, feel free to visit our website or get in touch with me directly.